The fourth is Greece. Dr. MILTIADES Karavis. Dr. Karavis is a board member of International Society of Oriental Medicine. Also, he is a member of the Society of Physical Medicine and Rehabilitation since 1992. Now, he is the president of a Hellenic Medical Acupuncture Society since 2012. His subject is development in the field of pain, especially musculoskeletal pain control with acupuncture. He is the author of 3 acupuncture monographs, co-authored of 3 chapters in 3 medical books, and have written and published 4 biomedical acupuncture textbooks. Dr. Karavis will present with the title of Monitoring and Management of Mild and Moderate COVID-19 Patients in Greece, Uncharted Waters.
Dear colleagues and friends, I welcome you from Athens, Greece, in this very important conference. And before I begin, I'm going to tell you that it's a great honor, a privilege for me to speak in very highly qualified audience. And today we are in lockdown again in Greece in this period of time. It's a rainy day, so it's a great opportunity for me to stay inside and to speak with you. Before I begin, I want to thank the organizers, and especially thanks to Dr. Sarah Song Mideok and Dr. Choi. It was very helpful, their assistance, and are great moderators in this kind of conference. So I can begin with my presentation. You can see the title. Only to clarify for you that the word uncharted waters means unknown waters, because we are talking about something that is very strange for us, for our experience. So we have to rethink medicine. We have to rethink our mission regarding patients, COVID-19 patients. And I will begin sharing with you the speech content. So I will give you some epidemiological data about Greece, the first and the second wave, and 2 innovations regarding the observation and monitoring patients at home. And also I will speak 2 things regarding the management of COVID-19 patients at home. I will give you 2-3 tips regarding acupuncture treatment and the mechanism of action, and to the end, the conclusions. So I will begin with some epidemiological data, and in these diagrams, you can see very clearly the first and the second wave in Greece. We are a population of 10 million people. So at the beginning, we are doing quite well at the beginning of March 2020. And Greece had no many patients, no many deaths. It was very, very light for us, you can see here, and very flat curve in the diagram. But now from November and then we have a very big number of cases, new cases, and hospitalized people and people in ICU. So our health system is struggling, and the doctors in the first line, they made a big effort to sustain the population. And the first innovation for us, it was that we can predict the next month, measuring the viral copies in the pipelines of wastewater of the city of Thessaloniki. And this is a very brilliant job from the Polytechnical University of Hellenic. And we saw from the October in the waste waters of Saloniki. This, you can see the pipelines of Saloniki, and here you can see the curve, the increase of the virus, and we saw that we had 500% increasing of virus concentration in waste waters. So we understand that after 20, 25 days, or maybe a month, we will have an increasing of new cases of COVID-19. So it was a very, very good job done from our Polytechnica institutes. And we have also a second innovation for monitoring COVID-19 patients at home. And this came from, we usually use from UK, the NEWS2, a scale, a score, a national early working score, in order to see and monitor the patients at home. And we can do that, first of all, looking at clinical picture of the patient and the symptoms. So we have to create 3 diagrams. The first diagram has the body temperature. We have to measure 2-3 times per day and to put in the diagram in order to see the temperature of our patient. The second diagram is to look after oxygen saturation level twice a day, and to put the numbers in a diagram also, and also to explain the patient how to do that. And the respiratory rate, because we know that if we have more than 25-30 breaths per minute, this is a very strong indication that we have a severe illness. So we have to explain to the patients to write down these 3 numbers in 3 separate diagrams in order to can advise them and to evaluate the situation. It's not easy, and we have it's very difficult to have blood tests in the home and COVID-19 test, rapid or PCR at home. But if this is possible, it will be a great opportunity. And a very important task is to advise the family and caregivers how to comport with the patient and how to see how is the evaluation of the disease. And taking all this data, we have in our hands 3 possibilities. First, we can give general recommendations about rest and adequate sleep, adequate hydration, to drink teas and waters and soups, and to be careful in nutrition, because it will be possible and probable that we'll take some medication. So we have to carry on with that. And we have advice for some supplements, vitamin C and D, and also some minerals. And the stress management is very important for our patients. And also, we have pharmacological treatment now, and we have guidelines how to care this patient at home. We begin low with paracetamol and acetylcysteine, and maybe oxygen if they need that. And we can go on with 3 second-line medication regarding dexamethasone, aspirin to protect coagulation, and therapy with antibiotics, especially azithromycin. And all that in order to see how to protect the patient, not to go to hospitalization, and to because the evaluation is very quick, and the COVID pneumonia starts in a few hours. So we have to monitor the patients very carefully. And the third line is acupuncture treatment And we have two things here to select acupoints according to symptoms, or to select acupoints according to pathophysiology, in what exact stage we are in our patients. And we speak about that later. And now we have a second innovation here in Greece, and we try to put that in the hospitals and in our offices. The name is Ergo, and is a very advanced breathing science. We can monitor 24/7 wireless the respiratory rate with a platform that measures every breath directly, with live analytics, automated scoring, and predictive alerts to doctors treating patients in the hospitals or at home. And now there are many hospitals, as you see, that runs clinical trials in order to see how useful is that in COVID patient monitoring. So what we have here is a very simple belt that patients wear, and this is a sensor that collects signals to the cell phone, and then send the signals to our console in the office or in the hospital, so we can monitor every breath he or she takes, and then to advise our patients in the monitoring center. So we can censor and write down and see real time the respiratory rate of our patient. So it was a very bright idea, and we're now in the States to see, especially in Italy, in some hospitals in Italy, to see how we can continue monitor the respirations of the patient, the respiration rate. And I will come to acupuncture treatment. That's I know that it's very, very known for you, but I want it good also for me to repeat all these things, that acupuncture has a protective role, because we can act on non-specific immunity and specific immunity. And we know that from data with animal models and with human researchers, that acupuncture can maintain in human homeostasis, so we can sustain non-specific immunity and protects the stress response system in our hypothalamus. We know from animals that acupuncture improves the number and the function of phagocytes, increase the number and activity of NK cells, natural killers, promote synthesis, secretion, and biological activities of cytokines, and adjust the content of serocomplement. But also in specific immunity, the cellular part, we know that acupuncture promotes the proliferation of T cells, improve the ratio CD4 to CD8, modulate the synthesis and secretion of cytokines, and increase velocity and effectiveness of immune response. And also regarding the humoral immunity, we know that acupuncture modulates the synthesis and secretion of various immunoglobulins and promote T helper lymphocyte secreting cytokines. So these are data that are consistent. We know they are published in very important journals. And in my clinic, and according to my view, I have some systemic acupoints for everyone at home, or patient, or asymptomatic, or healthy. So I have this pair of points that we can use in every patient, because it has a very systemic effect, a very generalized effect, no task specific. And also we have the Sumu technique that we can improve the function of internal organs using the back shoe and the front move point. So this diagram says everything we want to know about the systemic effect of acupuncture. And also, we have a very, very important tool, the auricular acupuncture points. And we can use here also semi-permanent needles. So we put them there and we leave them there for about 10, 12, 15 days. And we have a variety of acupuncture points in the ear that we can use them according to symptoms. And these are regions, are areas, no specific points. So it's not important to be very precise in locating them. And I want to share with you that we know that there are significant differences between different schools of auricular acupuncture regarding Chinese auricular acupuncture in Nozies, auricular acupuncture or Nibuaye or Bohr in Germany. So we have different location of points. It's not of big importance, all that. So this is also for protection. These points are also very useful to use them in healthy population. And now, if you are in a situation to treat a COVID-19 patient at home, you have first to think according to symptoms or organs that are affected. So with Shumu technique, we can assist the function of lung, of gastrointestinal system and the heart. But also symptoms are very important. So we have to use acupuncture points for the fever, for the cough, for the dyspnea, the headache and the pains. And we have from WFAS guidelines on acupuncture and moxibustion. And we have two categories, some points and some techniques for the patients that are under observation, and some points and techniques according to syndrome differentiation. We have two groups for mild to severe COVID-19, and one group with acupuncture points that we can use them in severe COVID-19 patients and also pneumonia. So I read this paper very carefully from WHO, and I systematically put it down in this one presentation in order to have them very quickly, and you can locate the acupuncture points. So at least to tell you some things about the long COVID-19 patients in primary care, because it's more probable that you will see these patients in your office or in their homes, because long COVID is a low-grade, subacute or chronic post-viral inflammation. And if we want to define post-COVID, is a long-term health effects associated with COVID-19. So we have long-term effects. We have after COVID, post-COVID. And the post-acute COVID are symptoms that are more than 3 weeks from the onset of the first pneumonia symptoms. And chronic COVID, we call the syndrome that lasts more than 12 weeks. And we know that 40 to 60% of the patients will develop long-lasting symptoms. So after the emergency. And in UK now, we have 60,000 long COVID-19 cases, and they create for their rehabilitation about 14 pioneer clinics for post-COVID or long COVID disease. And the most common symptoms after the COVID is fatigue, that last for months, shortness of breath, cough, joint pain, and chest pain. And we have some other symptoms as brain fog, depression, muscle pain, headaches, intermittent fever, palpitations, and tachycardia. So there are very important because the patient didn't feel well after the acute phase. And we can have also inflammation and injury of major organs. I can remind you that you have symptoms from the heart, and in the post-COVID control, we saw lasting damage to the heart muscle and increased risk of heart failure. And also in the lungs, we have long-standing damage to the alveoli. And in CT scans, we can see scar tissue that in the lungs that can lead to long-term breathing problems. The post-traumatic stress syndrome is present, so we have patients that are depressed and anxious with insomnia and difficulty of be active, kidney, renal failure, and problems in skin, rash or hair loss or urticaria, and also neurological long-term problems as anosmia, insomnia, and brain fog. That means we have problems with memory, attention, and concentration. So these are very important points that you can meet them weeks after the end of acute phase. And in this patient, you can choose also main points according to symptoms, and points according to the organ dysfunction that is present. And I give you some ideas what I use to these patients, especially auricular acupuncture is very helpful. The experience is not evidence-based, it's only experience-based. So no many patients come to us now with post-COVID disease, but it's very useful to have them as treatment. And I will give you some advice about this patient. First, you have to protect your patient and yourself when you apply acupuncture. You have to insist in detailed history. And here we have day-to-day clinical picture that can change. So it's very important to evaluate and see the patients every day. Prefer a holistic approach. So at the beginning, be careful to rest, sleep, hydration, food intake, herbs, vitamins, teas, mood, and we will go on slowly. And the advice is start low and go slow with the treatments and with medications and also with acupuncture. Select the most important points for your patient. Know every point that you know, 2-3 points in the ears and some points in the body, and then we can create a more complete program. Don't overtreat the patients. And I don't mention the mechanism of actions, only that is very useful in order to communicate to our colleagues in the hospitals, to have arguments about how all these things happens with acupuncture or with traditional medicines. So this is a very, very easy example that electroacupuncture is a mechanical, electrical, and chemical stimulation in the periphery that release endogenous opioid into inflamed tissues, especially from lymphocytes, monocytes, macrophages, and granulocytes. And these peripheral acting opioids activate the receptors on peripheral nerves, you can see here, and inhibit cytokine production on peripheral tissue. So the peripheral opioids can protect you from inflammation and also promote analgesia. So this is a very important mechanism, a very simple one, with systemic acupuncture points. We have this from animals and humans also. And this is a reference that gives us concrete evidence about the anti-inflammatory action of acupuncture regarding the regulation of TNF alpha, interleukin 6, and interleukin 1 beta. About 3 weeks after acupuncture, you can see here the difference in comparison with control group. So we know that this is true. We know that acupuncture can regulate the immune system, but we have to convince also our colleagues. And this is the acupuncture and immunity at a glance. And we have all these reports in order to convince the medical staff and also the state about the useful of our treatments. And I will end with some security concerns. We need evidence, at least towards medical community and state authorities. We have to address safety issues because we saw dermatological consequences of COVID-19, and in these dermatological problems on periphery is contraindication of acupuncture, so the herbs and is most useful than acupuncture. And also it's very important not to have false impression of security when we look at the patient at home, because very quickly can deteriorate the situation and to lead to hospitalization and ICU. So we have to be very careful and to be in contact also with the doctors that are in the front line in the hospitals. And acupuncture at home have increased risk of contamination also for us. And I have many concerns about quarantine rules, how we can go home, because now we use telemedicine. So it's safer, it's quicker, and we can do that. We can give advice, but no acupuncture. So acupuncture is useful for post-COVID syndrome, but no very useful for the COVID patients that are at home. And at least the cost of personal protective equipment, the masks, the shields, the gloves, etc., we can change. We have to change them in every patient we see. So this is a great cost for you and your patient. And I want to thank you here for your attention, and I am waiting for your questions. Thank you very much for the invitation.